This is Dr. David Stoker, a plastic surgeon in Marina del Rey. I wanted to take a moment to speak to you about medial thigh lifts or inner thigh lifts. It's a procedure that I commonly perform on patients who've lost a large amount of weight. It's when they have extra skin or wrinkly skin on the inner thighs, sometimes a lot of friction and irritation in that area, the inability to wear bathing suits or maybe short shorts if they'd like to, or maybe even just regular shorts. It's also a tricky procedure with a lot of particular elements to it that are not entirely obvious for a surgeon doing it in the first few times. Fortunately, I have a lot of experience with this procedure. Important point number one that I would make is usually I don't perform it as the first plastic surgery operation. If the patient is a candidate for a tummy tuck or a pubic lift or both, that's usually going to be their best bet and where we're going to want to start. That allows me to actually tighten the inner thighs quite a bit without even doing an inner thigh lift. In my experience, at least half of those patients won't even need a formal inner thigh lift because of the improvement I'm able to get with those other procedures. For those that do have a lot of inner thigh skin, however, the second stage will be performing that inner thigh lift. There are two types of inner thigh lifts. One, where the incisions are up high around where the underwear elastic would be. That's the most common type of procedure. And I basically remove a large ellipse of skin that starts in the pubic area, extends around underneath them all the way to their buttocks crease on the back. I'm able to undermine the skin, lift and tighten it up. I keep those incisions high so that they'll be concealed under shorts. The second type of inner thigh lift procedure is a vertical incision, typically going from the groin all the way vertically down to the knees. This is the less commonly performed type of inner thigh lift. It's going to be a more severe situation. Somebody who's lost 150, 200 plus pounds, or maybe somebody who's in their 60s or older. Those are the patients that are going to benefit from a large amount of skin and fat removal from the inner thighs. This procedure varies quite a bit depending on the individual genetics, weight loss, age of the patient. You definitely need an individualized consultation to get the best advice. So on that note, I recommend if you are interested in this procedure, give us a call, schedule your own consultation. I'd be happy to review what I think would be your best option. It's David Stoker here in Marina del Rey, California, going over medial thigh lifts.